spread of the virus remain in place. When the country moves to level 4 on the 1st of May, the following will happen. Our borders will remain closed to international travel, except for the repatriation of South African nationals and foreign citizens. No travel will be allowed between provinces, except for the transportation of goods and exceptional circumstances such as funerals. Public transport will continue to operate with limitations on the number of passengers and stringent hygiene requirements, including that all passengers must wear a face mask. The public is encouraged to stay at home other than for essential personal movement, doing essential work, and work in sectors that are under controlled opening. People can exercise under strict public health conditions that will be spelled out. All gatherings, apart from funerals and for work, will remain prohibited. Those who are elderly and those with underlying conditions must remain at home and take additional precautions to isolate themselves. The sale of cigarettes will be permitted. The range of goods that may be sold will be extended to incorporate certain additional categories. These will be detailed by the relevant ministers. It is important to note that several restrictions will remain in place regardless of the level of alert for as long as the risk of transmission is present. For instance, bars and shebeens will remain closed. Conference and convention centers, entertainment venues, cinemas, theaters, and concerts will remain closed. Concerts and sporting events and religious, cultural, and social gatherings will not be allowed until it is deemed safe for them to continue. The coronavirus is spread, as we have said before, by contact between people. If people do not travel and move around, the virus does not travel. We know, for example, that just one funeral in Port St. John's in the Eastern Cape and one religious gathering in Mangaung in the Free State contributed to a spate of infections in their respective provinces. From the evidence we have, we know that 75% of confirmed coronavirus cases are found in our country in just 6 metro municipalities. And they are Johannesburg, Ekurhuleni, Cape Town, Buffalo City, eThekwini, and Mangaung. It is therefore essential that we do everything in our means to restrict the movement of people, and although it runs counter to our very nature as human beings, to reduce the contact that each of us has with each other. Ultimately, it is our own actions as individuals that will determine how quickly the virus spreads. If we all adhere to instructions and follow public health guidelines, we will keep the virus under control and will not need to reinstate the most drastic measures. We can prevent the spread of the coronavirus by doing a few simple things. As we have said in the past, washing our hands frequently with soap and water, and the use of alcohol-based sanitizers. Keeping a distance of more than 1 meter between yourself and the next person, especially those who are coughing and sneezing. Try not to touch your mouth, your nose and eyes, because your hands may have touched the coronavirus on surfaces. I know this is difficult whenever you leave home. Our clothing and textile industry, including small businesses, are gearing up to produce these masks on a mass scale. The extraordinary measures that we have put in place to combat the coronavirus pandemic have been matched by the extraordinary contributions of many South Africans. We pay tribute to them, the nurses, the doctors, the scientists, and the community screening field workers who are leading our public health response. We are committed to ensuring that they have all the resources they need, including adequate personal protection equipment and other recognition to undertake the work that is being asked of them. As we slowly ease the lockdown restrictions, we are substantially and rapidly increasing our public health response. We have already seen a huge increase in community screening and testing that is going on throughout the country. Guided by advice from the World Health Organization and the Africa Center for Disease Control and Prevention, we have joined other African countries in placing mass screening and testing at the center of the next phase of our response. Earlier in the week, I announced an additional allocation of 20 billion rand to our health response to ensure that we have the beds, the medicine, the equipment, and personnel that are required when the country experiences the peak of infections. This evening, I also want to pay tribute to those who are providing essential services and goods, the truck, taxi, bus, and train drivers, the workers on our farms, in stores, at power stations, at water plants, at petrol stations, in the banks, in call centers, law enforcement officials, and security personnel. It is thanks to your efforts that we have been able to make such valuable progress in combating this pandemic. As part of expanding this effort, I have employed over 70,000 Defence Force personnel to assist with various parts of our coronavirus response. Until now, those Defence Force members that have been deployed have supported the South African Police Service in their responsibilities. They will continue to do so, but they will also be providing assistance in other essential areas. Continue to bless South Africa and continue to protect her people. I thank you.
So that was the President of South Africa, Cyril Ramaphosa, giving national address on the way forward of the lockdown. This was a highly anticipated national address. Is more than 100,000 people, okay, were watching the live streaming because everyone was like wanting to know what's going on. Are people going to be allowed to be moving around? Is the lockdown going to end? And all kinds of things. So one of the things that he spoke about is the border. They said the border will remain closed, okay? The borders, their international borders will remain closed only when it comes to the repatriation of South Africans back to South Africa, or if our countries want to repatriate their citizens from South Africa. Only then will the border be allowed to be open for them. And that's also, he also spoke of the cigarettes. He said you can now smoke, you're not allowed to smoke, because the sale of cigarette has been allowed. But he said movement is going to be limited, especially for public transportation. It's going to be a little bit more limited, and a whole lot other things that he spoke about. So yeah, anyway, please subscribe so that you don't miss on the daily updates we give to you.